Mr. Speaker, I would like to thank Congresswoman Woolsey for organizing this evening, and I rise today because our health care status quo simply does not work for older women and must be changed. The rising cost of health care and the lack of access to essential medical services is a problem for millions of Americans throughout our nation, but it is uniquely so for older women. Times of economic hardship like we are now facing truly illustrate the impact that our inadequate health care system has on older women. Older women disproportionately rely on their spouses for employer-based coverage in comparison to their younger counterparts and in comparison to older men. That is why over 1 million of them have lost health insurance due to a spouse's job loss during the current economic downturn. When an older woman loses her health insurance, it is even harder for her to find health insurance in the individual market, where there is little to no regulation, than her male counterparts. Older women, because of a combination of gender rating, age rating, and discrimination based on health status, face premiums that are roughly 4 times greater than those who have employer-based coverage. But it doesn't stop there. Women who are on Medicare who do have health insurance are disproportionately low income, have fewer resources, and suffer from more chronic conditions than men. As a result, they pay more in out-of-pocket costs than older men. Therefore, Medicare's ability to provide meaningful and protective health insurance coverage is critical to a senior woman's health and financial security. And that is exactly what health care reform does. In 2007, over 8 million seniors hit the donut hole, and 64% of those were women. Health care reform permanently closes the Medicare donut hole. Breast cancer is a leading cause of death for older women in the United States, yet 1 in 5 women aged 50 and above has not received a mammogram in the past 2 years. Health care reform improves Medicare to ensure that all prevention, including mammograms, is fully covered. 77% of Medicare beneficiaries living in long-term care facilities are women. Women are 3/4 of all nursing home residents. During a recent visit to a nursing home in my district in Lowell, Massachusetts, I was struck by a recent experience that truly illustrated this point for me. In one meeting, I looked at the crowd of senior citizens who came to ask me questions and express their concerns about the direction in which our country is going, and was struck by the fact that I saw only one man in the audience. While I later met a number of very interested male residents, the fact is that the typical nursing home resident is an 85-year-old woman who enters a nursing home because she lives alone and has no available caregiver. It is no wonder then that women are also more likely to need long-term care services. And that is why it is so important that we pass health care reform which provides voluntary, long-term insurance to help cover the costs associated with growing older for the millions of senior women who need it. No one should have to make decisions based on their finances rather than what is best for their health. We need health care reform in order to address the need that older women face for quality, affordable health care. Thank you, and I yield back.